Hello and welcome back to LTC Heroes Live. I am joined today by Charlotte Haberaecker. Did I pronounce that right, Charlotte?
You did.
Wonderful. And Ted Goins. I'm excited to be talking to both of them. Charlotte is the president and CEO of Lutheran Services in America, and Ted Goins is the CEO of Lutheran Services in Carolina. This is a unique interview because I don't often get to talk to, a network across the national level that is involved with advocacy, that is faith-based, but also bring in one of their important members. Charlotte, to get this conversation rolling, will you do a brief introduction of what Lutheran Services in America is and your role there?
Sure. Thank you, Peter. Lutheran Services in America is a national network of 300 Lutheran health and human services organizations that collectively reach 1 in 50 people living in America. We're in over 1,400 communities in 45 states. And what makes us unique is our shared heritage, vision, and mission, and the fact that we don't compete with each other, which opens up a real high-trust environment where people can trust each other, they can collaborate, they can innovate together. At the national level, what we do is bring the collective power of our national network together with national partners to advance innovation and achieve a healthier, more equitable future for people in America. 200 of our 300 organizations work with older adults. So this is core to our mission and has been core to the mission of the Lutheran Social Ministry Network for over the past 150 years. Our network has been caring for people with a broad range of continuum of services, from home community-based services all the way through affordable housing and all the full complement of senior living facilities. And we've been caring for older adults with dignity, respect, health, and independence, as I mentioned before, for well over a century.
I'd like to pause before we, introduce Ted and ask about how you two know each other. You specifically, before we hit record, I used the word association, and you said we're a network. And when you said that we're not competitors, that, kind of rang true to what you said, we're a network. Can you give an instance where maybe in an association that I might be familiar with, I might find that other members are competitors, but where at Lutheran Services in America, no, what you said is true. Can you give an example of where your collaboration ends up being different than competition?
So I think, first of all, it's the way we were created. Most of the organizations were created by somebody in a congregation at some point over the last 150 years that saw a need in the community and acted. And so they started caring for older adults, and it grew over time. And so part of it is geographic, the fact that we really started out as not competing directly. I think what we do at the national level is really leverage that trust and that non-competitiveness, because what it does is it opens up the door so that people can share freely. It's not someplace where you have to worry about, I'm taking your clients, you're stealing my money. This is where people can come and share, this didn't work. And that's where a lot of the learning occurs. It's also an area where we can bring in national partners and work together with us. This is an extraordinarily innovative network. And Ted, I know, will give lots of examples of the work that he does. And what it allows us to do is to work together to improve the way that we're able to empower older adults and enable them to live a full life with abundance.
So that's a perfect transition to introduce Ted. Can you tell me, if you can remember, how you met Ted, what role, and how long you two have been working together in Lutheran Services in America?
Sure. Well, Ted was on the search committee. He was the board chair when I joined Lutheran Services in America. So I've known Ted for about 10 years now. And he is one of our favorite members. We have lots of favorite members, but we work with Ted across the board and really all of our initiatives. Ted works not only with older adults, which is his largest area of service, but he also works with children, youth, and families, people with intellectual developmental disabilities, refugees, others. And so we really work with him across the continuum. It's one good example. A few years ago, Ted had done a pilot in his post-acute care in a transitional care situation where he was working with the University of North Carolina at Chapel Hill. And he found such value in the pilot. He was able to, so that older adults who left his post-acute care were not going back into the hospital, really be able to reduce that percentage that went back in the hospital. And Ted came to us and said, Charlotte, this is something all the different members should be interested in. And so we formed a partnership with the University of North Carolina at Chapel Hill. We went to the Harry and Jeanette Weinberg Foundation to get funding, and we implemented it in 7 of our members across the country. And in fact, right now, we're currently taking that kind of transition care model and kind of reapplying it to affordable housing in Brooklyn.
I love the introduction, and I'm going to ask Ted some questions, but just so you know where I'm going to take this, and anyone who's not watching this doesn't know that Wendy's marketers are in the background, Wendy and Chris, but they should be proud, because when I was going over their website today, the other thing that stood out was that you all excel at pilots and partnerships, and you just dropped it without even me prodding you for that. So Ted, in lieu of that, can you tell me a little bit why you are a member of Lutheran Services, and then also talk about your relationship with Charlotte and how you've grown to be an important member there?
Right. Well, I appreciate being with you today, and we are just one of those 300 members of the network. I think for us, it all goes back to our roots. That we were founded by the Lutheran Church. You don't have to be Lutheran to be served by or to work for Lutheran Services Carolina. As a matter of fact, it's hard to find a Lutheran around here. But that's not why we were created. We were created with a vision statement from John 10:10. I came that they may have life and have it abundantly. So we want abundant life for everyone. And Lutheran Services in America gives us that national presence that our little organization in the Carolinas could not have. We were started in 1960. As Charlotte said, we do a little bit of everything. Started with one nursing home and then kind of grew from there across both states. But we could not have that national voice and national presence. And I also love the information sharing, the pilot programs that we've been able to learn from and adapt and adopt from others across the network. Something that's going on in California, all of a sudden we hear about and say, we'd like to try that in the Carolinas. And there's no pride of ownership. It's just, we're all in this together, which is pretty phenomenal. And it also gives us that voice in Washington and across the country that, again, we couldn't have individually.
I'll ask this question of you, Charlotte, afterwards, but I'm going to put Ted on the spot because I want to hear his kind of gut reaction. When I was going through a Lutheran Services in America website, it specifically says that they're a different national model. Ted, you probably belong to a state association. There's potential that you belong to American Healthcare Association. What can you give me a concrete example about how your relationship and your work with them is different with Lutheran Services in America?
Yeah, and even in those organizations, and we are members of a number of organizations, including the ones you mentioned. But you're usually sitting in a room with your competitors. Now they're friendly competitors, but there's also a little bit of reserve. If I've got a good idea, I'm not sure I want to give it to my closest competitors that may take that and use it against me or use it to get a competitive advantage tomorrow. Mm-hmm. But when I'm with that group at Lutheran Services in America, it's all friends. It's all colleagues. Now we do occasionally butt up against each other, not much direct competition, but that's okay. It's again, I think it's just baked into the network, into how we were created by the church and with that church model, that sponsorship that has allowed all of us to work so closely together without fear. And that way, some of my best friends are members of that network that I have met through that network from day one of this organization, and I still keep up with a lot of those, even those that are retired.
Charlotte, moving to the specific topic or the copy for a different national model. When you were recruited or brought on at Lutheran Service in America, tell me what was surprising about the model. I'm interested in your personal reaction when you started to realize that this was unique. Can you remember thinking back and like, oh, they talk differently, or they hug more often than other networks? Is there anything that stands out for you when you were coming in?
Actually, it's funny you should say that. My first week on the job, I went up to Minneapolis to a meeting of our Lutheran Services in America Disability Network. And it was a group of our members that work with people with intellectual developmental disabilities. And it was my first week, so I was listening a lot, meeting people, and it was just very different from my experience I came from the corporate world, and then I came to the nonprofit world before Lutheran Services in America. And my impression of going to the nonprofit world before Lutheran Services in America is just as competitive, if not more so, than the corporate world, right? And so I came here, and it was just an immediate, this is different, right? And so what I set about doing was really maximizing that and seeing that as the secret sauce, as what could, because it's not just, we're not I don't think of us as an insular, it's not all about Lutherans, right, for sure. It's not all about even just the Lutheran social ministry organizations in our network. It's really about how do we strengthen these organizations, and then how do we empower people to live their best lives. And we can work together to do that because we're a phenomenal national network. We can bring in national partners in philanthropy, academia, healthcare, others to work with us as well. If you're really going to tackle some challenging issues, you really have to have lots of different stakeholders. And this is a phenomenal network that partners well with people, that really has just this amazingly deep passion and commitment for older adults and for all of the people that we empower.
Ted, I want to ask you, from, I guess the word's not outsider, but from sometimes a participant in the projects, but sometimes an observer in the projects. What are some of the pilots or partnerships that you're most proud of that the network pioneers?
I think the one that pops to mind closest is our senior network. We put together a group years ago and said, if we could find something that we could all do together, because I can't have a national presence. It gets back to, again, one of my reasons that LSA is so important, that I might not be able to have a national presence. But if I could hook up with the Lutheran organizations that are members that are in the Northeast, the Northwest, the Midwest, then we could have that national presence. And so we've come up with a couple of ideas. We're still working on that, still working through that. And frankly, we've had some that just haven't panned out. But at least we're in there on the cutting edge. And, sometimes things on the cutting edge and on the floor. And that's fine. We find ways to do things together. Charlotte mentioned the Disabilities Network. That's the one for us that has been extremely successful. We didn't really have services for folks with developmental disabilities, or not very much service, until we joined the Disabilities Network and learned from Virginia and Minnesota and other states how to get into that space and how to grow that in the Carolinas. And that now has become a very large and important part of our organization, just because of what we learned from folks doing the same work in other locations.
Ted, this morning I was watching an interview with you about your upbringing kind of in this industry, being a CNA, and the amount of decades, if I may, in long-term care. I've interviewed probably over 500 CEOs in long-term care in the last year, and I hear over and over that they feel that this is one of the most underappreciated industries in the U.S. If you think that's true, what can we do to start changing?
I started as a nursing assistant when I was in college. And I say nursing assistant because there was no such thing as certified back then. Matter of fact, I was on the floor the day I applied for my job. It's a much better system now because now we're training people to do that work. But that was a few years back when things were different in this world. But it's just it has given me kind of a grounding in what we do. And I still try to spend a day with our nursing assistants once or twice a year, just to remember and to be humbled by the work that they do every day. I couldn't do it every day, but it's nice to see them. And I think we need to talk about this more. We need to get people's attention. Finally during COVID, and sadly it took COVID to start talking about these people as heroes. And for once in their lives, they became the center of attention where they ought to be all the time. Now, sadly, as COVID, which is not over by any stretch, and our people today are masked and in lots of cases still in goggles, which is a hard way to work all the time. And that's still going on today. But already that is fading back from the front page, which is very sad, because then they're not being remembered for what they do every day and need to continue to do for us to all be successful.
Charlotte, your professional background is a little bit more diverse than mine and Ted's. I'm interested in your perspective on being one of the most underappreciated industry, and also, what you're doing at Lutheran Services in America to help change that.
Well, I think you're absolutely right, Peter, that the caregivers in long-term care have just these enormously challenging positions, right? They're working multiple shifts, particularly now with all the workforce shortages. They've been there since the beginning of the pandemic. These are people who deserve our respect. They deserve to be paid well. They deserve recognition for the hard work that they do. I know a number of our members, and we're active in advocacy and public policy and lifting up the stories and the visibility and the frontline heroes across our network. But it's also, working with the administration and Congress and, really sharing, what's happening here in terms of, I think they need to understand the workforce shortages better, and the caregivers working in long-term care are a critically important part of that. The reimbursement levels, as you know, are not there in terms of Medicaid. And the caregivers deserve more than Medicaid can provide them. And so I think it's in part, it's an advocacy and public policy initiative, but it's also anything we can do to kind of lift up the stories, the visibility, raise that with everybody so that they can see the value of the work that they provide.
Charlotte, when we spoke a couple weeks ago and started to tease out some of the topics that both you and Ted were passionate about, one of the topics that is on the front of everyone's mind is the workforce shortages. And we talked about, this is an education issue around the industry at the I would say even at the societal level, but definitely at the congressional level. What are some of the conversations that you're having in Washington, D.C., where you think there's a chance that we're going to be able to have an impact, and maybe 2 years from now, 3 years from now, 4 years from now, the national government will be able to help with some of these issues?
From my perspective, I think we're still at the education level, right? And really making sure that people understand the demographic drought, right? That understand the workforce shortages and what it means. What we do at the national level, we bring credible faith-based leaders like Ted, who are deeply committed to caring for older adults, who are well known for quality, compassionate care. We bring them to talk directly to Congress and the administration. And because of the diversity within our network, we can bring some of the largest nonprofit members, but we can also bring small rural providers. And so we can bring people to the table to educate folks on the fact that, their rural nursing home may be the only healthcare provider within a 6-hour radius, right? One of my members shared with CMS the fact that, the local prison commissary could pay more than he could pay in his rural community for a CNA, right? They can share the fact that we're paying, in some cases, $90 an hour for a staffing agency for a CNA, things that are not sustainable. So I think the first part of raising the visibility and the education is bringing these credible voices, these lived voices to the table. I think the other part of it is really emphasizing it's about the people, right? The message is that older adults and their families are not having access to the services that they need to age with dignity, independence, and respect, particularly low-income older adults. And so we're seeing reduced admissions, reduced number of beds, especially in skilled nursing facilities, largely due to workforce shortages, other regulations, Medicaid reimbursements. We did a survey within our network, and other respondents, over 90% said that they were reducing number of skilled nursing beds. We're seeing increased waiting lists for admissions. Older adults are being left in hospitals and not able to find a bed in a skilled nursing facility. So I think the message, we try to put the people at the center of all the work that we do. And I think the message is really around how do we ensure access so that older adults have access to the services that they need, and their family who cares for them also has access to those services. And currently we have a problem. And if you think about the growth in the older adult population, if you think about the growth, for example, in the over 85-year-old population, where almost 3/4 of them need some kind of long-term services and supports, we're going to see a growing need for this.
Charlotte, one of the studies that you all sent me a month or two ago was the demographic drought that was presented and organized by, I believe, someone in your network, Ron Hetrick. That was a very, very well organized document. I'd be interested in what you think that you all have been able to help execute and implement, whether it be on the short term or long term, because he ended up his presentation with a number of good examples.
So first of all, he was an outside speaker for us for our CEO Summit. He's a senior labor economist from MC Brennan Glass. And so he was terrific in terms of presenting before the pandemic, the demographic trends during the pandemic and afterwards. And so everybody walked away, if they didn't know it already, and this is not a short-term thing. It's not like people are coming back tomorrow, right? He gave statistics like of the 11 million job openings, over 6 million don't require a college degree. And yet there's only about 2.1 million people without college degrees looking for jobs, right? And so that goes directly to the gap in, CNAs, dietary workers, maintenance workers, and others, right? So I think part of it is getting that word out and making sure that people really understand this is not a short-term thing. It's not when people come back from unemployment insurance, right? We're there. It's even, moving potentially to a recession. There's still are workforce shortages. In terms of what we've been able to do, I think, the real answer, he gave us a number of different suggestions, but honestly, I think there's no single answer here, right? If you look at the gap, there is immigration, there's use of technology, there's partnerships, there's education, there's innovation. But I think it's going to take a lot to be able to really be in a position where we can make sure that older adults that need care have access to that care, and that the families that care for them have access to that care as well.
Ted, I've been to 5 or 6 state conventions in the last 6 or 7 months, and I think one of the topics that people most share ideas with over coffee, breakfast, lunch, beer is work shortage. What are some of the conversations, tips, and strategies that you've shared with the members at Lutheran Services in America?
And we talk about, this is the issue. For years, reimbursement was the number one issue. Now it's still right up there at the top because you can't pay the wage that you have to if you don't have the reimbursement to do it, since we're so Medicaid and Medicare constricted. But for the first time in my history, now it's recruitment and retention is the number one R. Is that recruitment and retention of staff. So at every meeting, I was just at an AHCA meeting. I was just with a group at Leading Age, and the topic is the same around, and it's not just in the Carolinas, it's all across the country, that we just can't recruit and retain enough people to do the work. As Charlotte mentioned, and the statistics are obvious, it just seems like people aren't willing to, the people that are in the position just are not in a position to take the action that we need. I was just in DC advocating for some work on either a foreign guest worker program, immigration reform. And, it's just so disheartening to hear nothing's going to happen before the election. And then even after that, it takes, sometimes years for things to gear up. So we've kind of been told we've got to go find our own solutions, and it's not going to be, the government's not going to be the one that comes up with that solution. So for instance, one of the things that we're all doing and all talking about, we started attracting staff from Puerto Rico. And of course, that's part of the United States. So it's an easier lift to get them to the United States. But then when the pandemic hit, that completely stopped and really hasn't even started back yet, though it's starting to loosen up a little bit. But because of that, then we started moving on to, and I think everybody is recruiting in foreign workers, at least for nurses. You can't bring foreign workers in generally for less skilled jobs, which is we desperately need. But we've ordered one, just for our little organization, 100 nurses from overseas, from Mexico and the Philippines, We've got 22 that are en route, but that takes months. I mean, like 6 or 8 months at best. So at least it's a long-term solution, but it's not going to get us there. So one of the things I've been advocating unsuccessfully for at this point, and again, it gets back to Charlotte and the advocacy effort, is a foreign guest worker program very similar to what it already exists for farmers, for hospitality workers, but to make that available for people that work in long-term care, which would get us some of those folks that we need. I think one statistic I've seen is about 25% of long-term care workers nationwide are immigrants. And our organization actually does refugee and immigration work. So it's a nice collaboration between two different parts of our organization. But I really do think that that's one of the answers. But there's lots, and it's not one thing. It's 1,000 little things that are helping us get through this this crisis.
Ted, you mentioned the fact that reimbursement was at the number one priority for a good 10 or 15 years. And I always think that it's not that reimbursement became less of a priority. On a scale of 1 to 10, reimbursement was probably 97 out of 100, and staffing just moved to like 101. So it didn't move down in its weighted importance. It just got outranked by staffing. I'm interested in given that post-acute care struggled so much with the education aspect of getting Congress to understand that reimbursement is just below operational numbers. What is the angle that you think that we should either take or spend more time or more money on in terms of reimbursement when you go to DC? What could we do better?
I think we've got to tell and Charlotte already said this, we've got to tell our message better and louder. I woke up thinking about doing this morning and thinking about the fact that our elders are silently suffering. And my mother lives in a nursing home, in a memory care unit. But our elders, including my own mother, are suffering and actually dying because of this situation, this workforce crisis. I've started calling it an emergency, a workforce emergency, because I really truly believe it's just that it's not on the front page of the paper, and we've got to find a way to get that on the front page without it being a horror story about nursing homes. That's not the problem. The problem is not having that adequate reimbursement to be able to pay the staff enough to do the job. And the other side of that is the elder suffering and the workforce. They're really justice issues. Who are the ones that are suffering most? And I don't think we've couched it in the terms of justice. And that's what this is all about. It's justice for our elders, and it's justice for the rank and file people that work in our facilities. And that's a largely immigrant and low income and racially diverse population that are trying to make ends meet on much less than it costs to live.
Well, the kind of the quote that stood out to me from our first conversation was, right about this point in the chat, I said, are both of you really pessimistic about the future of long-term care? And the reaction you gave me was almost visceral. You both were very optimistic. And one of the things that you said, Charlotte, you said working with faith-based leaders allows you to have a different set of optimism. Could you give me some examples, Charlotte, of where you think that kind of the network you have keeps you a little bit insulated from when the government's not there to help you, when the society doesn't understand? I like the word that Ted used with justice. I hadn't used that beforehand. Can you give some examples, Charlotte, of where you see the optimism inside of your network?
Yeah, I think we're people of hope. Right. So I think just, we, have very strong commitment to our mission and to our values that we share with each other. And so ultimately, we are people of hope. And so what gives me hope are the extraordinary network of organizations and people like Ted and others throughout this network who just really deeply care about the well-being of older adults, about their workforce. They're innovative, they partner well with others, they're dedicated, they persevere. in many cases, they've been persevering for 150 years, right? So I think there's this sense of people who are, one of the things that we do is, we really bring people together, right? And at a time in our country when so many are divided, we are united in our mission and our dedication to empowering older adults to live a life with dignity, purpose, and abundance. And when I look at this network and I look at other partners outside this network that we can be working with and partnering with, I see hope and opportunity. Do I think it's short term that all these problems we're talking about are going to be solved? No, but I do see that there's a path forward. And I think, people like Ted and others are really a critical part of making this happen.
Thank you for highlighting that specific environment that you work with. And I work remotely, so I don't get to work with a bunch of inspirational leaders like Ted and the rest of the members with you. Ted, I want to kind of wrap up our conversation with some personal questions aimed at you and Charlotte. And the one that I learn a lot from interviewing so many CEOs are, who are the people that have inspired you? So I want to ask you, Ted, do you have a mentor, whether the person's in long-term care or not? It might be a family member, it might be a neighbor, who has a direct impact on the way that you approach delivering care in our industry?
Yes, I've got one or two or three that I would love to share.
Please.
The first is, every year we give out 7, what we call, because it's our acronym, our LSA, our small LSA, the LSA Loyal Service Awards. And we give that to 7 people across our organization that best exemplify the mission, vision, and values of our organization. And we bring them together and have lunch. We just did this a few weeks ago, had lunch with our board. And there are 7 mentors just right there. And these are mostly direct care workers, nursing assistants, environmental services, dietary staff. And every one of them, when they were given a chance to say thank you to the board and the staff at our board meeting and luncheon, they spoke about God, and they spoke about family, and family meaning the people that they worked with every day. And so when you hear that coming from the rank and file people that we work with, our teammates every day, it's really inspirational. My mentor, who is has since passed away, Isaac Kuhn was the first licensed administrator in our organization, and I had the opportunity to work directly for him. Bob Beard was matter of fact, sat in this seat at this desk that I'm sitting at now, and he was a huge mentor. I actually worked for him directly for a couple years when I was just starting out, about 40 years ago, a little over 40 years ago now. And then certainly my parents. My dad was a Lutheran minister. My mother should have been. My uncle was a Lutheran minister, and they wanted another Lutheran preacher in the family. And I did not find the call in the ministry, but I found my call through Lutheran Services.
Those are wonderful shout outs, and thank you for sharing those mentors. Charlotte, how about for you? I know it might not be in long-term care. Your leadership is to gather up and motivate a network that goes way beyond long-term care. I read that you touch 1 out of 50 Americans, but is there someone who's made you the leader that you are, Charlotte?
I've been very fortunate in having some wonderful mentors earlier in my career. I was in management consulting at Price Waterhouse, when I was at Fannie Mae. And so I have any number of kind of wonderful mentors who've really encouraged me in my career, and I really learned from. And I really try to emulate as part of that. I think, I also look at just ongoing, even the people that I work with, not only on my team, but I look at Ted and the other members. We instituted a set of leadership awards to really kind of raise the visibility of people and the kind of the mentoring they would do. One of the awards is called the MICA Award, which is MICA 6.8. It's mercy, justice, equity for our members. One of them is on innovation and sharing innovation across the network. Another's on mentorship and the importance of mentoring others. That, in fact, was a new award that we offered this year. So I find, a lot of inspiration within this network.
Charlotte, the last question that I want to ask you, and I want you to, be as personal as you feel comfortable. What has the pandemic taught you about yourself or your leadership at Lutheran Services America? And on a positive note, like, what did you learn about yourself, that you're resilient, or in times of stress you handled this, or maybe you discovered a new love language that you hadn't thought of? What stands out for you? Charlotte, for you.
Yes, no, I'm thinking. Sorry, I'm reflective. I think perseverance, has been critically important. I think it's been just this all hands on deck to support this network. We're one of the largest nonprofit networks that works with older adults. It's just been hit so hard with the pandemic, right? And I see organizations like TED's and others, but we also work with people with disabilities and children, and we do 24/7 care. So just, the level of perseverance to get through this has been critically important. I think, part of what we do is we bring to our members, we have a CEO summit where we bring our members together with outside expertise, but also talking among themselves. One of the things we have as part of that, which has been huge through the pandemic and our virtual sessions, has been, we have a CEO, theologian in residence, who really frames the beginning of the day and the end of the day, and has really brought some profound insights to our members who have been so struggling. And he puts it so in everyday language for people that I think that, and I steal his words, I put it in my CEO updates on Mondays because he's so inspirational. But to me, that's been just huge for our members. And, just keeping that connection, just checking in and making sure everybody is okay throughout the network. Communicating, we certainly tried to communicate a lot more to touch people. But, and I think that's important. It's reaching out, even though we're not necessarily in person, right?
Ted, for you, what's something that you're become self-aware of in the last 3 years since the pandemic that has changed who you are as a leader that might not be the case had we not faced COVID?
For 60, we've been around for about 60 years. And during that whole time, people have said we should not do most of the stuff that we do because it's just too hard. Nursing homes, developmental disabilities, all the things where we are needed most, but where it's probably the hardest place to serve. At least I thought it was the hardest place until COVID hit, and then found out because the biggest thing we do is 8 skilled nursing facilities across the state. And of course, we were right in the crosshairs of COVID, and we suffered along with everybody else in the country. But again, it gets back to Charlotte mentioned perseverance, and the fact that I think the biggest thing I learned is that culture wins. We had just kind of tried to take our corporate culture, such as it is, and put it on paper. We'd never done that before. We thought about doing a Disney model or a Ritz-Carlton model, but we said, that's not us. We're Lutheran Services Carolinas. Let's just do the LSC way and try to put the best that our people do down on paper, and then the rest of us can try to emulate that model. And we had just put that in place right before COVID hit. And I can't tell you how many times over the last couple of years I've heard people say, when I say, why are you still smiling? And they say, it's the LSC way. Because it's our way to continue to do the mission, vision, and values regardless. And even in the midst of the pandemic, I think the only thing I can share that came positively out of that is that culture, and the fact that two of my mentors live just a quarter of a mile right over there. My dad, who I've been able to have lunch with almost every day for 3 years during this pandemic because I couldn't travel. So I just started sitting on his back porch and eating meals with him. And then Tom Herlocker, who was one of the founders of Lutheran Services in America, and another mentor that lives in the same campus here in Salisbury. And to have them in my backyard and really captive, because they couldn't go anywhere and neither could I. It's been good for us to continue to find ways to do this good work.
I love that. Go ahead.
Peter, I was going to say, if you ever have an opportunity to go on a visit of any of Ted's facilities, his staff come up to him and insist on having a picture with him and putting it on Facebook. I mean, he is just like a rock star.